The fluorescent lights hum overhead. White floors stretch down the corridor, polished to a cold shine that reflects every shadow, every hurried step. County General Emergency Room at 6 in the morning carries the weight of exhaustion and coffee burned too long on the burner. Dr. Maya Reyes pushes a supply cart down the hallway. Third-year surgical resident, 29 years old. She keeps her head down, eyes forward, shoulders squared in a way that suggests discipline more than submission. She's restocking trauma bays again. It's the third time this week. Her hands move with mechanical precision. Gauze packs aligned in perfect rows. Hemostats organized by size. Intubation kits checked and rechecked. Every item placed with exact spacing, like muscle memory she can't quite shake. She doesn't think about it. Doesn't need to. Her fingers just know. The kind of efficiency that comes from repetition under pressure. From somewhere you don't talk about. Laughter echoes from the nurse's station. Sharp, dismissive. Dr. Garrett leans against the counter, coffee in hand, smirking at something Dr. Singh just said. Both attendings, both confident in the way people are when they've never been told they're wrong. Garrett's voice carries down the hall. She's been here 6 months and still can't close an appendectomy without supervision. Singh chuckles, shaking his head. Bradshaw keeps her on scut work for a reason. Probably worried she'll freeze up in a real emergency. Maya's jaw tightens, just slightly. Her hands don't stop moving. She doesn't look up, doesn't respond. She learned a long time ago that words don't prove competence, results do. And even then, some people refuse to see. She adjusts a supply tray. Moves to the next bay, keeps going. There's a small tattoo on her left wrist, faded. 3 letters partially visible under her watchband. NRT. She catches herself staring at it, pulls her sleeve down, adjusts the watch so it covers completely. Some things are better left hidden. The trauma bay doors swing open. Organized chaos. A gurney rushes past, paramedics shouting vitals. Maya steps aside, back pressed to the wall. Eyes tracking the movement with the kind of focus that doesn't come from textbooks. Chief Surgeon Dr. Robert Bradshaw strides past, late 50s, silver hair, command presence that fills every room he enters. He stops when he sees Maya. Reyes. She straightens. Yes, sir. I need someone to manage overflow patients in Bay 3. Minor lacerations, possible fractures. Think you can handle that without screwing up? His tone isn't cruel, just dismissive. Like he's already decided what she's capable of. Maya meets his eyes, steady, calm. Yes, sir. He nods once and moves on. Doesn't wait for confirmation, doesn't need to. She's not a surgeon to him. She's a pair of hands that follow orders. She heads to Bay 3. 3 patients waiting, 2 stable, 1 on a gurney in the corner, monitor beeping erratically. The nurses are clustered near the door, looking toward the hallway. Waiting for an attending, waiting for someone else. Maya glances at the monitor, flatline, asystole. The patient is coding and no one's noticed yet. She moves, fast, smooth, no hesitation. She's at the bedside before the alarm even registers with the nursing staff. Her hand goes to the patient's neck. No. No pulse. She places both hands on the chest. Perfect hand placement. Perfect compression depth. 30 compressions. 2 breaths. Her voice is calm, clear, no panic. Start compressions. Someone page cardiology, now. One of the nurses freezes. Dr. Reyes, you're not authorized to. Now. The nurse runs. Maya doesn't stop. Her compressions are rhythmic, mechanical, like a metronome. 120 beats per minute. Exactly. She doesn't count, doesn't need to. Her body just knows. 2 minutes pass. 3. She doesn't stop. The monitor hiccups. A single beep, then another. Sinus rhythm begins to establish. Weak, but there. The patient gasps. Chest rises. Pulse rebounds under her fingertips. Maya steps back, strips her gloves, wipes her hands on a towel. Nurse Ellen stares at her, wide-eyed. How did you? Maya's expression doesn't change. Lucky timing. She turns and walks out. Doesn't wait for questions. Doesn't wait for praise. There won't be any. There never is. They'll call it luck, instinct, anything but skill. She's fine with that. Safer that way. Later in the locker room, Maya opens her locker. Inside, tucked behind her spare scrubs, is a folded piece of paper. The edges are frayed, worn from being handled too many times. She doesn't unfold it, just touches it, runs her thumb across the creases. Some things don't need to be seen, only remembered. She closes the locker, locks it, turns to leave. Dr. Singh is standing in the doorway. He looks at her differently now, not with respect, with curiosity, like she's a puzzle he can't quite solve. That save in Bay 3, that was impressive. Maya shrugs. Patient coded, I responded. Most third years would have waited for an attending. Patient didn't have time to wait. Singh studies her, then nods slowly. Where'd you do your undergraduate training? Maya's expression stays neutral. State school, nothing special. It's not a lie, just incomplete. Singh doesn't push. But he doesn't stop looking at her like she's something other than what she appears. Maya walks past him, out of the locker room, back into the controlled chaos of the ER. She has 4 more hours on her shift. 4 more hours of being underestimated. 4 more hours of proving herself to people who will never see it. But that's fine. She's used to it. She's been hiding in plain sight for 6 years, and she's gotten very, very good at it. The hospital cafeteria at noon. Fluorescent lighting hums over rows of empty tables. Maya sits alone in the corner, tray untouched in front of her, coffee going cold. She stirs it absently, staring at nothing in particular. Lunch break. She doesn't eat much anymore. Hasn't had much appetite since. The sound cuts through. Distant, ambient. A helicopter passing overhead. Rotors thumping through the air. Faint enough that no one else seems to notice. But Maya hears it. Always does. Her hand tightens around the coffee cup. Knuckles white. Her breathing slows. Controlled, deliberate. The cafeteria flickers. Just for a second. Desert sun. Blinding white. Sand everywhere. A field tent with canvas walls snapping in the wind. Blood on her hands. Screaming in the background. Someone calling her name. Not the name she uses now. The other one. Lieutenant. She blinks. The cafeteria returns. Solid. Real. The helicopter sound fades. Maya exhales slowly. Forces her fingers to relax. Sets the cup down carefully. Her hands are steady now. They always are, eventually. 6 years ago, Helmand Province, Afghanistan. Navy Forward Surgical Team. She was someone else then. Wore a different name, a different uniform. Carried a different weight. She left that behind. Left the desert. Left the wars. Left the screaming and the blood and the faces she couldn't save. But not the training. Never the training. That stays in your bones. The ER hallway. An hour later. A gurney rushes past, paramedics flanking it. Gunshot wound. Civilian gang violence. Blood soaking through the sheets. Resident Carter is beside the gurney. Face pale, hands shaking. GSW to the abdomen, BP dropping fast, we need. Maya glances up from her charting. Her posture shifts. Subtle. Shoulders pull back. Eyes sharpen. The shift is instinctive, automatic. She knows that look. Pale lips, shallow breathing, skin going gray. Hemorrhagic shock. Stage 3. Maybe 4. She follows. No one asks her to. No one notices. The trauma bay erupts into controlled chaos. Dr. Garrett is lead. He's good, competent. But he's never worked a GSW in a war zone. Never had to find a bleeder with your hands while mortars shake the tent. He's struggling. I can't find the bleeder. Blood everywhere. Suction can't keep up. The patient's pressure is tanking. Maya steps closer. Watches. Her eyes track the blood flow. The angle. The depth. She knows where it is. Garrett's looking too distal. Too surface level. Maya moves in. Doesn't ask. Just gloves up and reaches into the wound. Her fingers move with absolute certainty. No hesitation. She finds it in 3 seconds. Iliac artery. Proximal branch. You're searching too far down. She clamps it. The bleeding stops. Garrett stares at her. Then at the clamp. Then back at her. Where the hell did you learn to do that? Maya steps back. Strips her gloves. Anatomy textbook. Chapter 12. Her voice is flat. Neutral. She doesn't meet his eyes. She turns and walks out. Behind her, Garrett stands frozen. The nurses exchange glances. One of them is Nurse Ellen. Mid-40s. 20 years in trauma. She's seen a lot of residents come through. None of them move like that. Ellen watches Maya leave. Frowning. Thoughtful. That wasn't textbook. That was experience. Later, the locker room. Maya changes out of her blood-stained scrubs. Her movements are sharp, efficient, each motion precise. She folds the old scrubs with corners aligned, edges tight, military creases. Habits don't die, they just hide. She opens her locker. Inside, behind the folded paper, there's something else. Small, tarnished, a dog tag on a thin chain. Engraved text, Lt. M. Reyes, USN, Lieutenant, United States Navy. She doesn't touch it, just looks at it for a moment. Then closes the locker, locks it. Some things stay buried, for a reason. The ER at night, quieter now, the rush has passed. Maya walks the halls, checking on post-op patients. It's scut work, grunt work. But she doesn't complain. She passes a room. Inside, an older man, veteran. She can tell by the way he holds himself. The way his eyes track movement. The way he doesn't sleep, even though he's exhausted. She's seen that look before, in the mirror. She steps inside, checks his chart. Routine post-surgical. Surgical follow-up. How's the pain? The man looks at her, studies her face. Manageable. His voice is rough, worn. You serve? Maya's hand pauses on the chart, just for a second. Why do you ask? The way you move. The way you check the room when you enter. The way you stand. She doesn't answer. He nods slowly. Thought so. Maya finishes her notes, turns to leave. Thank you for your service, he says quietly. She stops in the doorway. Doesn't turn around. You too. Then she's gone. Down the hall, past the nurse's station, past the whispers and the doubts and the assumptions. She's good at this, at hiding, at being invisible, at carrying a past no one can see. But sometimes she wonders how long she can keep doing it. How long before the weight of who she was collides with who she's pretending to be. She thinks about the 16 faces, the ones she couldn't save. Helmand, 2018, 1 month, 16 Marines, kids most of them, 18, 19, 20. She did everything right, everything, and they still died. She couldn't keep doing it, couldn't keep losing them, couldn't keep waking up at night, hearing them call her name. So she left, took a medical discharge, walked away from the uniform, from the rank, from the wars. But she kept the skills, kept the training, kept the ability to save lives when no one else could. She just does it quietly now, without the uniform, without the recognition, without the weight of rank and responsibility, and the eyes of commanders watching every move. She does it because it's the only thing she knows how to do. The only thing that makes the 16 faces a little easier to carry. Maya stops at a window, looks out at the city lights. The hospital never sleeps. Neither does she. Not really. She touches her wrist, the tattoo hidden under her watch. NRT, Navy trauma. The team she served with, the teen she left behind. She wonders if they think about her, if they wonder where she went, if they understand why she couldn't stay. Probably not. But that's okay. She's not looking for understanding, just peace, and maybe, someday, forgiveness. From herself, for surviving when they didn't. The ER entrance, sirens wail in the distance, growing louder. Ambulance bay lights flash red and blue against the white hospital walls. It's 2 in the afternoon, and the calm is about to shatter. Dispatch crackles over the radio. Multiple vehicle collision. Highway 101. 5 critical incoming. ETA, 3 minutes. Chief Bradshaw appears in the hallway, barking orders. His voice cuts through the ambient noise like a blade. Get trauma 1 and 2 prepped. I want every available attending on deck. Move. Staff scramble, residents running, nurses grabbing equipment. The controlled chaos of preparation. Maya is near the supply closet. She hears the call, doesn't move yet, just listens, counts. 5 critical, 2 trauma bays, not enough hands. Someone's going to be left waiting. The ambulances arrive, 3 of them. Sirens cut off abruptly. Rear doors fly open. Paramedics shouting vitals as gurneys flood through the entrance. Male, mid-30s, steering column impalement, systolic at 70 and dropping. Female, early 20s, head trauma, GCS of 6. Male, 50s, chest trauma, possible flail chest. Bradshaw and Garrett move. Of to the first patient. Singh takes the second. The third gurney rolls past them. No one moves toward it. Young woman, unconscious, chest trauma. Her breathing is shallow, labored, skin pale, lips tinged blue. No attending, she's alone. Maya moves, fast, smooth, no hesitation. She's at the gurney before anyone registers. Her hands go to the patient's neck. Trachea deviated to the right. She listens to the chest. Left side. No breath sounds. Tension pneumothorax. Collapsed lung. Air trapped in the pleural space. Pressure building. Mediastinum shifting. Heart and vessels compressing. Minutes until cardiac arrest, maybe less. Maya's voice is calm, clear, no panic. Get me a chest tube kit, now. The nearest nurse, a young guy, maybe 2 years in, stares at her. Dr. Reyes, you're not authorized to, now. He hesitates, looks around for an attending, sees none, runs. Maya preps the site. Betadine swabbed across the ribs, 5th intercostal space, mid-axillary line. She counts the ribs with her fingers, muscle memory. Done this 100 times, just not here, not in 6 years. The kit arrives. She doesn't wait for approval, doesn't wait for supervision. The patient doesn't have time. Scalpel, she makes the incision. Clean, confident, blunt dissection through the intercostal muscles. Her fingers find the pleural space. She inserts the tube. Air and blood hiss out. The sound is immediate, unmistakable. The lung reinflates. Trachea shifts back to midline. Breath sounds return. The monitor stabilizes. Oxygen saturation climbing. 78, 82, 89, 94. 2 minutes. She saved her. Maya steps back, strips her gloves. Blood on her scrubs. She doesn't look rattled, doesn't look proud, just focused, clinical. Bradshaw turns from the first patient, sees Maya, sees the chest tube, sees the patient breathing. His jaw tightens. Reyes. His voice is sharp, angry. Maya straightens, meets his eyes, calm. Yes, sir. Who authorized you to perform a thoracostomy? No one, sir. You're a third-year resident. You don't make those calls. She was dying, sir. That's not your decision to make. Maya doesn't flinch, doesn't argue. She's alive. The simplicity of it hangs in the air. Undeniable. Bradshaw stares at her. His face is red, jaw tight. Other staff are watching now. Residents, nurses. Everyone saw what just happened. Get out of my trauma bay. Maya nods once. Strips her gloves. Walks out. No defense. No justification. The patient is breathing. That's the only answer that matters. The hallway. Maya walks steadily. Doesn't look back. Her hands are steady. Her breathing controlled. But inside, something is cracking. She's been careful for 6 years. Kept her head down. Stayed invisible. And in 2 minutes, she just blew that apart. Nurse Ellen follows her into the hallway. Keeps her distance. Waits until they're away from the crowd. Dr. Reyes. Maya stops. Doesn't turn around. Where did you learn to do that? Maya's shoulders tense. I read a lot. Ellen steps closer. Her voice is low. Not accusatory. Just curious. No, you didn't. Maya turns, looks at her. Ellen's expression is calm, knowing. I've been in trauma for 20 years. I've seen a lot of residents. None of them move like you. None of them have that kind of confidence under pressure. Sure. Maya says nothing. Ellen nods slowly. You've done this before, a lot, haven't you? Maya's jaw tightens. I did what needed to be done. That's not an answer. It's the only one I have. Maya walks away. Ellen watches her go, frowning, thoughtful. She doesn't know what Maya is hiding, but she knows it's something. Later, the staff lounge. Maya sits alone, coffee in hand, untouched. She stares at the wall, replaying the procedure in her mind. Textbook perfect, but too fast. Too confident. She gave herself away. The door opens. Dr. Singh enters, sees her, sits down across from her. That was impressive. Maya doesn't respond. I'm serious. That patient would have died without you. She would have died without the chest tube. Most residents wouldn't have recognized it that fast, wouldn't have acted. Maya looks at him. Is there a point to this? Singh leans forward. Yeah, there is. You're not like the other residents. You don't hesitate. You don't second guess. You just know. Experience. Not the kind you get in med school. Silence. Singh studies her. You've worked trauma before. Real trauma. Haven't you? Maya stands. I need to get back to work. She walks out. Leaves Singh sitting there. He watches her go. He doesn't have answers, but he's asking the right questions, and that's a problem. Maya walks the halls, her mind racing. She's been so careful, so controlled. But instinct doesn't lie. Training doesn't hide. And now people are noticing. She passes a reflective window, sees herself. Scrubs, stethoscope, white coat. She looks like a resident, but she moves like a soldier. And eventually, someone's going to figure out why. Evening shift. The ER has quieted. The chaos from earlier has settled into a low hum of activity. Maya is restocking supplies again. Routine. Familiar. Safe. She prefers the night shift. Fewer people. Fewer questions. Fewer eyes watching her every move. The automatic doors slide open. Heavy footsteps. Deliberate. The kind that come from someone who's walked through war zones. Maya doesn't look up. Not yet. A man enters. Mid-40s. Civilian clothes. Jacket zipped high despite the California heat. Jeans. Boots. But the posture is unmistakable. Military. The way he scans the room. The way he moves with purpose. He stops. Stares at Maya. His face shifts. Recognition. Disbelief. Then certainty. Reyes? The voice is quiet, but it cuts through everything. Maya freezes. Her hand tightens on the supply cart handle. She knows that voice. She turns slowly. Master Chief Petty Officer Daniel Voss. Helmand Province. 2017. She operated on him. IED blast. Femoral artery nearly severed. He was bleeding out on the table, and she spent 40 minutes keeping him alive while mortars shook the tent. He shouldn't be here. Shouldn't recognize her. She left that world behind. Maya's face goes blank. Controlled. She looks away. You're mistaken. Voss steps closer. His eyes don't leave her face. No, I'm not. Other staff nearby. A few nurses. A resident. They glance over. Curious now. Voss's voice is steady. Certain. Lieutenant Reyes. Navy Trauma Team 7. Forward Surgical Team. Helmand Province. Maya's breathing slows. Her shoulders tighten. She keeps her voice low. That's not my name anymore. But it was. She takes a step toward him. Him. Close enough that her words don't carry. Stop. Voss looks at her. Really looks at her. Sees the tension, the fear, the desperation to stay hidden. He softens. Just slightly. You saved my life. Maya's jaw tightens. You're confusing me with someone else. Helmand. IED blast. You were the surgeon. I was bleeding out and you wouldn't let me die. You kept working even when the shelling started, even when everyone else took cover. The words hang in the air. Too specific. Too accurate. Chief Bradshaw appears from around the corner. Arms crossed. Suspicious. Reyes. Problem here? Voss looks at Bradshaw, then back at Maya. No problem, sir. Just recognizing an old friend. Bradshaw frowns. Looks at Maya. Friend? Maya answers quickly. Too quickly. He's mistaken. Voss shakes his head. Calm but firm. No, I'm really not. More staff gathering now. Dr. Singh, Dr. Garrett, Nurse Ellen. They sense something happening. Something important. Singh steps forward. What's going on? Voss ignores him. Keeps his eyes on Maya. You still have the scar? Left shoulder. Shrapnel. You wouldn't let anyone treat it until the Marines were stable. Silence. Maya doesn't answer. Doesn't move. But her silence is confirmation enough. Bradshaw's voice is sharp now. Reyes, explain. Maya looks at him. Her face is stone, but her eyes betray her. It's not relevant. Voss turns to Bradshaw. She was Navy. Trauma surgeon. One of the best I've ever seen. Stunned silence. Garrett's voice breaks it. That's impossible. She's a third-year resident. Voss shakes his head. She was operating on Marines and SEALs 6 years ago. Saved my life. Saved 18 others in one night during a mortar attack. Worked for 16 hours straight without stopping. The room goes still. Everyone is staring at Maya now. She closes her eyes, breathing controlled, deliberate. This is it. The moment she's been hiding from for 6 years. It's out now. No taking it back. Singh speaks. His voice is careful, measured. Is that true? Maya opens her eyes, looks at him, then at Bradshaw. She doesn't answer. Voss does. Lieutenant Naya Reyes, United States Navy. Surgical team attached to Marine Special Operations. She operated under fire more times than I can count. Saved lives no one else could have saved. Bradshaw's expression is unreadable. Anger, confusion, something else. My office, now. Maya nods, turns to walk. Voss calls after her. Lieutenant. She stops, doesn't turn around. Thank you for everything. She doesn't respond, just keeps walking. Behind her, the whispers start. Residents, nurses, everyone processing what they just heard. The quiet third-year resident, the one they dismissed, underestimated, ignored. She was a combat surgeon. Nurse Ellen watches Maya disappear down the hallway. She's not surprised, not really. She suspected something, just didn't know what. Now she does. Garrett stands frozen, remembering every dismissive comment, every condescending look, every time he questioned her abilities. Singh is quiet, thoughtful, pieces clicking into place, the confidence, the precision, the way she moved without hesitation. It all makes sense now. Voss stays in the ER. A nurse approaches him. Is it true, everything you said? Voss nods, every word. Why didn't she tell anyone? Voss looks toward the hallway where Maya disappeared. Because she's running from something, and I just dragged her back to it. Bradshaw's office. The door closes. Maya stands in front of his desk, posture rigid, hands clasped behind her back. Military stance. She doesn't even realize she's doing it. Bradshaw sits, stares at her. Is it true? Silence. Reyes, answer me. Maya's voice is quiet, steady. Yes. You were a surgeon, military. I was. And you didn't think to mention that in your residency application? I left that behind. I wanted to start over. Bradshaw leans forward. You lied. I omitted. That's the same damn thing. Maya doesn't respond. Can't. He's right. Bradshaw stands, paces. Do you have any idea what kind of position this puts me in? Puts the hospital in? I'm sorry. Sorry doesn't cut it. Silence. Bradshaw stops, looks at her. Why? Why hide it? Maya's jaw tightens. Because I couldn't do it anymore. I couldn't keep losing people. Couldn't keep seeing their faces every time I closed my eyes. Her voice cracks, just slightly. I needed to be someone else. Someone who didn't carry that weight. Bradshaw studies her, sees something he didn't expect. Vulnerability, pain. He opens his mouth to respond. The overhead PA crackles. Mass casualty alert. Structural collapse. Downtown construction site. Multiple critical injuries. All available personnel to ER. Repeat. Mass casualty. Bradshaw's expression shifts. He moves toward the gore. We'll finish this later. Maya follows. Because right now, none of it matters. People are dying. And she's the only one who can save them. The ER explodes into chaos. Sirens wail. Ambulances flood the bay. Gurneys everywhere. Blood. Dust. Screaming. Construction site collapse. 15 stories. Scaffolding gave way. Workers fell. Others crushed under debris. Paramedics shout over each other. Male, 30s, unconscious. Crush injuries to both legs. BP barely palpable. Female, 20s, impaled by rebar, through the shoulder. Multiple fractures, internal bleeding. We need help. Bradshaw is in the center of it. Trying to coordinate. Trying to maintain control. Triage, sort them by severity. Critical to trauma 1. Singh, take the impalement. Garrett, crush injuries. But there are too many, too much blood, too much chaos. Residents are freezing, overwhelmed. The volume is beyond anything they've trained for. Maya stands at the edge, watching. Her mind is already sorting, counting, prioritizing. 7 critical, 4 urgent, 3 can wait. She sees a gurney pushed aside. Man in his 20s. Rebar through his abdomen, still in place. He's conscious, screaming. Resident Carter is staring at him, panicking. I don't know how to, I can't. Maya moves. Instinct overrides caution. She's at the gurney. Her voice is calm, commanding. Don't remove it. Stabilize around it. Pack the wound. Get him to OR immediately. Carter stares at her. But, now Carter, he doesn't have time. Carter nods, runs. Another patient. Elderly man, crushed chest, no pulse. A nurse is about to call it. He's gone. We need to focus on. Maya is already there, hands on his chest, starting compressions. Not yet. The nurse hesitates. Dr. Reyes, we have limited resources. Then don't waste time arguing. Maya doesn't stop. Compressions. NS, perfect rhythm. She's done this 1,000 times. Intense, under fire, in places where giving up wasn't an option. 2 minutes, 3. The monitor beeps. Faint, then stronger. Pulse returns. Get him upstairs. The nurse stares, then moves. Maya stands, looks around. Her posture has changed. Shoulders back, head up, eyes sharp. She's not hiding anymore. Can't. Not when people are dying. She moves through the ER like a general through a battlefield, directing, correcting, saving. That patient needs a chest tube, not just oxygen. Reposition that airway, you're going to lose him. Stop the bleeding first, then worry about the fracture. Staff listen. They don't question, because she's right, every time. Bradshaw watches from across the room. He's seen combat medics before, seen military surgeons. Maya moves like them. No, better. She moves like someone who's done this in hell and walked out alive. Singh sees it too. The way she doesn't hesitate, doesn't second guess. She just knows. This isn't textbook knowledge. This is experience. Hard won, blood bought. A sound cuts through the chaos, low, growing louder. Rotor blades, heavy, military. Everyone stops, looks up. Through the windows, a helicopter descends. Black, navy markings visible on the side. It lands in the ambulance bay. Dust swirls, rotors still spinning. The side door opens. 2 officers step out. Dress uniforms, crisp, authoritative. Commander's insignia on the shoulder of the lead officer. Commander Lisa Hayes, mid-50s, sharp eyes. Command presence that fills every space she enters. She walks toward the ER entrance, purposeful, direct. Bradshaw moves to intercept, confused, defensive. This is a civilian hospital. You can't just... Hayes doesn't slow down. Commander Lisa Hayes, Naval Medical Command. I'm here for Dr. Reyes. Bradshaw blinks. Dr. Reyes is a resident here. She doesn't. Hayes stops, looks at him. Lieutenant Reyes holds a reserve commission with the United States Navy. We're reactivating her under emergency protocol. You can't just walk in here and... Yes, Commander, I can, and I am. Her voice is steel. Bradshaw's jaw tightens. She's in the middle of a mass casualty event. I can see that. Hayes scans the ER, finds Maya. She's at a patient's side, blood on her scrubs, focused, controlled. Hayes walks toward her. Staff part, watching. Maya looks up, sees Hayes. Her whole body goes still. She knew this day would come, just didn't know when. Hayes stops in front of her. Lieutenant Reyes. Maya straightens. Instinct, muscle memory, military posture. Commander. Her voice is steady, but her eyes betray her. Hayes's expression softens, just slightly. We need you. Maya swallows. Ma'am, I'm not. You are. You've always been. You just took a detour. Silence. Hayes continues. Field hospital training program. Stateside. Teaching next-generation trauma surgeons. We need someone who's been there, done it, survived it. Maya's jaw tightens. I left for a reason. I know. I read your file. I know about Helmand, about the losses, about why you walked away. Hayes steps closer. But you didn't stop being a surgeon. You're still saving lives. You just changed uniforms. Maya looks away. I can't go back. I'm not asking you to. I'm asking you to teach, to pass on what? What you know. So fewer kids die because their medic didn't know what to do. The words hit hard. Maya closes her eyes. Hayes's voice is quieter now. Master Chief Foss reported finding you. Said you saved a patient today with a field procedure. Said you moved like you never left. Maya's eyes snap open. He had no right. He had every right. You're still on inactive reserve. Technically, you never fully separated. Maya stares at her. I didn't know. Medical discharge paperwork was never finalized. You were granted extended leave, not separation. The realization sinks in. She never actually left. She just stopped showing up. Hayes extends a hand. You don't have to decide now, but we're asking. The Navy is asking. Maya looks at the hand, then at the ER around her. The chaos, the blood, the lives hanging in the balance. She's been running for 6 years, hiding, pretending to be someone she's not. But the truth is out now. And maybe that's not the worst thing. She shakes Hayes's hand. I'll think about it. Hayes nods. That's all I ask. You have my contact information. Use it. She turns to leave, then stops. Lieutenant, what you did today, in this ER, that's who you are. Don't run from it. Hayes walks out. The helicopter lifts off. Dust swirls again, then settles. The ER is quieter now. The initial wave handled. Patients stabilized, some heading to surgery, others to ICU. Maya stands in the middle of it all. Blood on her hands, exhaustion in her bones. But something else too. Clarity. Bradshaw approaches. His expression is different now. Not angry. Thoughtful. That was impressive. What you did here. Maya looks at him. I did what needed to be done. No, you did what no one else could. He pauses. We need to talk about your future here. But not now. Now you need rest. Maya nods. She walks toward the locker room. Staff watch her pass. Respectful. Curious. She's not the quiet third year anymore. She's something else entirely. And everyone knows it. Conference room. Empty now. Just Maya and Commander Hayes. The helicopter is gone, but Hayes stayed behind. Said they needed to talk. Really talk. Maya sits, hands folded on the table. Calm exterior, storm inside. Hayes sits across from her, patient, waiting. You've been avoiding this conversation for 6 years. Maya doesn't respond immediately. Then, quietly, I left for a reason. And that reason, silence. How you explain it? The weight, the faces, the names you can't forget, no matter how hard you try. Maya looks at the wall. Her voice is barely above a whisper. I lost 16 patients in 1 month. Helmand, 2018. Hayes listens, doesn't interrupt. Marines, SEALs, kids, 18, 19, some barely 20. I did everything right. Everything by the book. Every procedure perfect. And they still died. Her voice cracks, just slightly. I couldn't keep doing it. Couldn't keep losing them. Couldn't keep hearing them call for their mothers while I tried to stop the bleeding. Hayes leans forward. So you ran. Maya's jaw tightens. I survived. By hiding who you are. By trying to be someone else. Someone who didn't have 16 ghosts following her everywhere. The room is quiet. Just the hum of fluorescent lights overhead. Hayes speaks carefully. You saved 18 lives in 1 night. During a mortar attack. Do you remember that? Maya closes her eyes. I remember the 16 I didn't save. That's not fair to yourself. Fair doesn't matter. They're still dead. Hayes reaches across the table, places a folder in front of Maya. Open it. Maya hesitates, then does. Inside, photos, letters, faces she recognizes, Marines she operated on. Ones who survived, letters from their families, thanking her, saying their sons came home because of her, because she wouldn't give up. Maya's hands shake. She closes the folder, pushes it away. I can't. You have to. Why? Because you're not just the 16 you lost. You're also the 18 you saved, and the dozens of others before and after. You don't get to only carry the failures. You carry all of it. Tears well in Maya's eyes. She doesn't let them fall. It doesn't feel like enough. It never does. That's the burden of being good at what you do. You remember every loss more than every win. The door opens. A nurse pokes her head in. Dr. Reyes, we need you. Patient crashing in Bay 2. Maya stands immediately. Instinct. Hayes watches her go. Even now, even broken, she doesn't hesitate. Bay 2. A patient coding. Young man. Early 20s. Post-op complication. Internal bleeding. Resident Carter is panicking. Pressure's dropping. I can't find the source. Maya moves in. Gloves on. She doesn't ask permission. Her hands find the bleed in seconds. Clamps it. Calls for sutures. Get me 30 silk. Now. Carter hands it over. Watches her work. Fast. Precise. Like she's done this 1,000 times. Because she has. 2 minutes later, the bleeding stops. Pressure stabilizes. Maya steps back. Strips her gloves. Carter stares at her. How did you do that? Maya looks at him. Really looks at him. Because I had to. Because he didn't have time for me to hesitate. She walks out. Back to the conference room. Hayes is still there. Waiting. Maya sits down, exhausted. That's the 3rd life you've saved today. Maya doesn't respond. Hayes continues. We're not asking you to go back to war. We're asking you to teach, to train the next generation, so they don't have to learn the hard way, so fewer of them come home in boxes. Maya's voice is hoarse. I don't know if I can. You're already doing it. Here. Every day. You're just doing it alone. Silence. Hayes stands. Think about it. You have time, but not forever. She walks to the door, stops. And Maya, stop punishing yourself for surviving. They wouldn't want that. She leaves. Maya sits alone. Hours pass. Evening becomes night. She goes to her locker, opens it, pulls out the folded paper, the one she's carried for 6 years. She unfolds it. Commendation letter. For valor. For 18 lives saved during sustained enemy fire. Signed by a general she never met. She reads it, then folds it carefully. But this time, she doesn't put it back. She holds it. Footsteps behind her. Bradshaw. Can we talk? Maya turns. Nods. Yes, sir. Bradshaw steps into the locker room. Hands in his pockets. Uncomfortable, but determined. I owe you an apology. Maya blinks, surprised. Sir? I underestimated you. Worse than that, I dismissed you. Treated you like you were incompetent, when you're actually one of the best surgeons I've ever seen. He pauses when I watched you. You today during the collapse. The way you moved. The way you commanded the room. That wasn't luck. That was experience. Real experience. Maya says nothing. Bradshaw continues. I don't know everything about your past, and I'm not asking, but I know enough, and I was wrong. He extends his hand. If you stay, I want you on my trauma team, officially, as an attending, not a resident. Maya stares at his hand. I'm not finished with my residency. You finished it 6 years ago, in a war zone, under fire. You've got more field experience than half my staff combined. He keeps his hand extended. I'm offering you a position. Lead trauma surgeon. You'd be the youngest we've ever had. But you've earned it. Maya looks at the commendation letter in her other hand, then at Bradshaw's outstretched hand. 2 paths, 2 futures. She doesn't have to choose just one. She shakes his hand. I need time to think. Bradshaw nods. Take the time you need. But don't take too long. We need you. He leaves. Maya alone again. She looks at the letter, then at the dog tags hanging in her locker. Lieutenant Maya Reyes. Dr. Maya Reyes. Maybe they're not different people. Maybe they're the same person, just different uniforms. She thinks about the 16 faces, the ones she couldn't save, and for the first time in 6 years, she thinks about the 18 she did, the letters in the folder Hayes gave her, the families who got their sons back, the lives that continued because she refused to quit. Maybe Hayes is right. Maybe she doesn't get to only carry the losses. Maybe she has to carry it all, the good and the bad, the saved and the lost. Maya folds the letter, places it back in her locker. But she leaves the locker open, not hiding anymore. She walks out into the ER. Night shift. Quiet now. But she's not running. Not anymore. She's exactly where she needs to be. 3 weeks later, County General Emergency Room. Morning light through the windows. The usual controlled chaos of shift change. But something is different. Maya walks through the hallway. White coat, stethoscope. Same as before. But the way people look at her has changed. Residents nod respectfully as she passes. Nurses greet her by name. No more dismissive glances. No more whispered doubts. She's Dr. Reyes now. Not the 3rd year they ignored. The surgeon they respect. Trauma they. Bradshaw is leading a case. Chest trauma. Possible cardiac tamponade. He's prepping for pericardiocentesis. He looks up. Sees Maya observing from the doorway. Dr. Reyes, your assessment? Maya steps forward. Confident but not arrogant. She examines the monitor, the patient's presentation. Beck's triad. Hypotension, muffled heart sounds, distended neck veins. Pericardial effusion, compressing the heart. He needs immediate drainage. Bradshaw nods. Agreed. You want to take lead? A few weeks ago, the question would have been unthinkable. Now it's routine. Maya steps to the table, gloves on. Ultrasound-guided approach. Subxiphoid window. She works, smooth, precise. The room watches in silence. Needle inserted at the correct angle. Fluid aspirates. Dark. Bloody. The patient's pressure stabilizes immediately. Bradshaw watches. Impressed, but not surprised anymore. Textbook. Maya strips her gloves. Just following protocol, sir. But they both. Hey, no, it's more than that. Conference room. Later that morning. Staff meeting. Attending physicians. Senior residents. Bradshaw at the head of the table. Effective immediately, we're implementing new trauma protocols based on field surgical techniques adapted for civilian use. He gestures to Maya. Dr. Reyes will be leading the training program. Weekly sessions, mandatory for all surgical residents. Heads turn toward Maya, some curious, some skeptical. Most respectful. Doctor. Singh raises his hand. Will this include combat medicine techniques? Maya nods. Adapted for civilian trauma, yes. High-pressure scenarios, limited resources, making critical decisions under stress. Singh leans forward. I'd like to assist, if you'll have me. Maya meets his eyes, remembers the doubt, the questions, the suspicion, but also remembers him listening, trying to understand. I'd appreciate that. Dr. Garrett shifts uncomfortably, finally raises his hand. Dr. Reyes. Can I speak with you after the meeting? Maya nods. Of course. The meeting ends. Staff filters out. Garrett approaches slowly, hesitant. They walk into the hallway, away from others. Garrett stops, looks at her directly. I owe you an apology. Maya waits. I said things about you, about your abilities. I questioned your competence, called you inexperienced. He pauses. The words are hard for him. I was wrong, completely wrong, and I'm sorry. Maya studies him, sees genuine remorse. Apology accepted. Garrett exhales. I'd like to learn from you, if you'll let me. I know I don't deserve it after. Maya raises a hand, stops him. Everyone makes assumptions. What matters is what you do after you realize you're wrong. She extends her hand. First lesson. Never assume you know everything. Stay humble. Stay curious. Garrett shakes her hand, grateful. Understood. He walks away, lighter somehow. Maya watches him go. Redemption isn't loud. It's quiet moments like this. One conversation at a time. Teaching lab. That evening, Maya is setting up mannequins, trauma scenarios, chest tubes, emergency airways, field amputation techniques. The door opens. Nurse Ellen enters, carrying supplies. Thought you might need help. Maya smiles, small but genuine. Always. Ellen starts organizing equipment. They work in comfortable silence for a few minutes. Then Ellen speaks. I knew that you were different. Maya glances at her. How? The way you moved. Like you'd done everything 1,000 times. Like nothing surprised you. Maya nods slowly. I have. Done it 1,000 times. Ellen stops, looks at her. Why hide it? Maya sets down a trauma kit, thinks about the question. Because I wanted to be normal, just a doctor, not a soldier, not someone defined by war. But you are both. Maya looks at her. Yeah, I'm starting to see that. Ellen smiles. For what it's worth, I'm glad the truth came out. We need people like you. People who've been through hell and came out the other side. I didn't come out clean. No one does. But you came out. That's what matters. They finish setting up. The lab looks ready, professional, like a real training center. Maya steps back, looks at it. This is her legacy now. Not just the lives she saves, but the lives she teaches others to save. First training session, 2 days. Days later, 20 residents packed into the lab. Nervous, excited, curious. Maya stands at the front, calm, authoritative. My name is Dr. Maya Reyes. Some of you know my background. Some of you don't. It doesn't matter. What matters is what I'm going to teach you. She walks between the mannequins. You will face situations where everything you learned in a textbook won't be enough, where the patient is dying and you have seconds to decide, where the correct answer isn't written down anywhere. She stops, looks at them. I'm going to teach you how to think under pressure, how to stay calm when everyone else is panicking, how to save lives when the odds say you can't. The residents are silent, listening. Maya picks up a scalpel. This is a tool, but your mind is your real weapon. Master your fear, master your doubt, and you can save anyone. She demonstrates a chest tube insertion. Fast, confident. Explaining every step. The residents watch, absorbing. Singh assists, adds context, asks questions that help others understand. By the end of the session, every resident has practiced. Every resident has improved. They file out, energized, grateful. One young resident, fresh out of medical school, approaches Maya. Thank you, Dr. Reyes. That was incredible. Maya nods. Come back next week. There's more. The resident leaves. Maya is alone with Singh. He smiles. You're good at this. Teaching. Maya shrugs. I'm trying. No, you're succeeding. Those kids are going to be better surgeons because of you. Singh pauses. For what it's worth, I'm sorry I doubted you. I should have seen it sooner. Maya looks at him. You asked questions. That's not doubt. That's curiosity. I respect that. Singh extends his hand. Partners? Maya shakes it. Partners. That night, Maya walks the ER. Old habit. She still prefers the quiet of the night shift. She passes the trauma bay, stops, looks inside, empty now, clean, waiting for the next emergency. She thinks about the 16 faces, still remembers them, always will. But now she thinks about the 18 too, and the 3 she saved today, and the 20 residents she's training to save others. The weight is still there, but it's balanced now. Not just loss, also hope. She walks to the window, looks out at the city. Somewhere out there, Commander Hayes is waiting for her answer. The Navy wants her back. Not for war, for teaching. And Bradshaw wants her here, leading trauma, training the next generation. She doesn't have to choose. She can do both. Teach military medics on weekends, lead trauma here during the week. 2 worlds, 1 purpose, saving lives. Maya pulls out her phone, finds Hayes' contact, types a message. I'm in, part-time, weekends, training only. Sends it. 3 dots appear, then a response. Welcome back, Lieutenant. Maya smiles. She's not running anymore. She's building something. Something that matters. 6 months later, County General Hospital. Golden afternoon light streams through the windows. The ER hums with its usual rhythm. Controlled, efficient, alive. Maya walks through the trauma bay. Lead trauma surgeon now. Youngest in the hospital's history. She wears the title quietly, without arrogance, just steady competence. A critical case. Multi-vehicle accident. Patient with flail chest, paradoxical breathing. Hing, residents gathered around, watching, learning. Maya's voice is calm, clear, teaching even as she works. Multiple rib fractures, unstable chest wall. We need to stabilize breathing first, then address internal injuries. She demonstrates, hands moving with precision. The residents follow every movement. One of them, the young resident from her first training session, assists. His hands are steadier now, confident. He's learned well. Good. Maintain positive pressure ventilation. Watch for pneumothorax. The patient stabilizes. Crisis averted. Maya steps back, lets the resident finish. Close him up. You've got this. The resident nods, nervous but determined. Maya watches for a moment, then moves on. This is what she does now. Not just saving lives, teaching others to save them. Hospital courtyard, sunset. Maya sits on a bench, still in her scrubs. A rare moment of quiet. Footsteps approach. Commander Hayes, in civilian clothes this time. Relaxed but still carrying that unmistakable command presence. Mind if I sit? Maya gestures to the bench. Not at all. Hayes sits. They watch the sun drop toward the horizon. Quiet for a moment. You made your decision. Maya nods. I did. Staying here, teaching at the base on weekends. Best of both worlds. Hayes smiles. I'd say you're spreading yourself thin, but I've seen your work. You thrive under pressure. Maya considers that. I'm learning to balance it. The civilian work, the military training. It's not easy, but it feels right. Hayes nods. The medics you're training speak highly of you. They say you don't sugarcoat, don't hold back. You teach them what they actually need to know. Because I've been where they're going. I know what they'll face. That's exactly why we need you. They sit in comfortable silence, watching the light fade. Hayes speaks again, softer now. How are you doing, really? Maya takes a breath. Better. Not perfect, but better. The 16? Still there, always will be. But I'm carrying the 18 too now, and everyone since. It's heavy, but it's balanced. Hayes puts a hand on her shoulder. You've come a long way, Lieutenant. Maya smiles slightly. Maya, just Maya. Hayes stands. For now, but you'll always be Lieutenant to me. She walks away. Maya watches her go. 2 worlds, 1 person. Finally at peace with both. Naval Training Facility, weekend, Maya in fatigues. Teaching a class of young medics, fresh faces, eager, scared, hopeful. She stands before them holding a trauma kit. You will see things no one should see. You will lose patients, good people, friends, and it will break you. The medics are silent, listening. But you will keep going. Because someone's life depends on you, not giving up, ever. She opens the kit, pulls out instruments. These are tools, but your calm is your real weapon. Your ability to think clearly when everything is chaos. Master that, and you can save anyone. She demonstrates techniques: field amputations, tension pneumothorax decompression, hemorrhage control under fire. The medics practice. She moves between them, correcting, encouraging, teaching. One young medic, barely 19, struggles with a chest tube insertion on the mannequin. Maya kneels beside him. Breathe, you're thinking too much. Trust your training, trust your hands. She guides him through it, step by step. He gets it. The tube slides in, perfect placement. He looks up, grateful. Thank you, ma'am. Maya nods. You're going to save lives. Remember that when it gets hard. She sees herself in their eyes. Young, uncertain, determined. She was them once. Now she's who they'll become. County General, night shift. Maya walks the quiet hallways. Old habit. She still finds peace in the stillness. She passes the memorial wall. Photos of staff who served. Military. First responders. Those who gave everything. She stops, looks at the faces, thinks about her own. The 16 she lost. She's made peace with it, mostly. But some nights, she still hears them. Still sees their faces when she closes her eyes. Tonight is one of those nights. She pulls out her phone. Opens a file she's kept for years. Letters he wrote to the families of the 16. Never sent, just written. A way to process, to remember, to honor. She reads one. A young Marine, 20 years old, from Texas. Died from wounds she couldn't stop. The letter talks about his courage, his humor, how he stayed calm, even as he was dying. How he asked about the other Marines before asking about himself. Maya closes the file. She'll never send them, but writing them helped. Helped her remember they were people, not just losses, not just failures. They were sons, brothers, friends, and she did everything she could. Sometimes everything isn't enough, but it's still everything. She continues walking, reaches the rooftop access, climbs the stairs. The rooftop, dawn breaking on the horizon, city waking below. Maya stands at the edge, wind in her hair. She reaches under her scrubs, pulls out the dog tags, the ones she's worn every day for 6 months now. Not hidden anymore. LT, M. Reyes, USN. She holds them, feels the weight. She thought she left the war behind, but the war gave her something: purpose, skill. The ability to stand when others fall, the ability to save lives that would otherwise be lost. She clips the tags back around her neck. Visible now, part of her uniform. She's not running anymore, not hiding. She's exactly where she's supposed to be. Lieutenant, doctor, teacher, survivor. She's all of it. And she's finally okay with that. The sun rises. Light spills across the city. A new day. New patients. New students. New lives to save. Maya turns, walks back inside. The hospital wakes around her. Staff arriving. Shifts changing. The constant rhythm of healing. She heads to the trauma bay. Scrubs in. Prepares for whatever comes. Because that's what she does. That's who she is. Not defined by her past, but informed by it. Strengthened by it. Made better because of it. The best thing you can do with your past is use it to save the future. And that's exactly what she's doing. One patient at a time. One student at a time. One life at a time. Final shot. Maya in the trauma bay, leading a team. A critical case. She's focused, calm, alive. This is where she belongs, not in spite of her past, because of it. The screen fades to black. Text appears. To those who serve in silence, your scars are not weaknesses. They are proof you survived something that mattered, and the world still needs you. The text fades. Silence. Then the sound of a heartbeat monitor. Steady, strong, alive. Fade out. End.